Shilajit is a thick, sticky tar-like substance with a color ranging from white to dark brown, sometimes found in Caucasus Mountains, Altai Mountains, and Tibet Mountains and mountains of Gilgit Baltistan Pakistan. It is used in Ayurveda, the traditional Indian system of medicine. It has been reported to contain at least 85 minerals in ionic form, as well as triterpenes, humic acid and fulvic acid. Terminology: Shilajit comes from the Sanskrit compound word Shilajit meaning rock invincible, which is the regular Ayurveda term. It is also spelled Shilajit and Shilajit. Shilajit is known universally by various other names, such as mineral pitch or mineral wax in English, black asphaltum, asphaltum punjabinum in Latin, also locally as Shagai, Darobi, Barashan, Baragshan, Murmlai, Bragtsun, Chautong, Wulingzi, Bardagi, and Arkhartash. The most widely used name in the former Soviet Union is mamayo, a word of Greek origin, which is variably transliterated as mumijo, mumio, momia, and momio. Active ingredients: the primary active ingredients in Shilajit are fulvic acids, dibenzoalpha-pyrones, humins, humic acids, trace minerals, vitamins A, B, C and P, phospholipids and polyphenol complexes, terpenoids. Also present are microelements. History: Shilajit is a substance mainly found in the Altai, Himalaya, and Caucasus Mountains. The color range varies from a yellowish-brown to pitch black, depending on composition. For use in Ayurvedic medicine, the black variant is considered the most potent. Shilajit has been described as mineral oil, stone oil or rock sweat, as it seeps from cracks in mountains due mostly to the warmth of the sun. There are many local legends and stories about its origin, use and properties, often wildly exaggerated. It should not be confused with ozocorite, also a humic substance, similar in appearance, but apparently without medicinal qualities. In fact, neither of the substances, ozocorite nor Shilajit, possess any scientifically proven medicinal qualities. Once cleaned of impurities and extracted, Shilajit is a homogeneous brown-black paste-like substance, with a glossy surface, a peculiar smell and bitter taste. Dry Shilajit density ranges from 1.1 to 1.8 grams per centimeter 3. It has a plastic-like behavior. At a temperature lower than 20 degrees Celsius per 68 degree Fahrenheit it will solidify and will soften when warmed. It easily dissolves in water without leaving any residue, and it will soften when worked between the fingers. It is still unclear whether Shilajit has a geological or biological origin, as it has numerous traces of vitamins and amino acids. A mamayo-like substance from Antarctica was found to contain glycerol derivatives and was also believed to have medicinal properties. Based on currently available studies, the bioactivity of Shilajit lacks substantial evidence. The immunomodulatory activity does not stand the test of critical assessment and is considered as unproven. Research: mamayo Shilajit has been the subject of scientific research in Russia and India since the early 1950s. Though there is no clinical study to support any benefits to human health, some observed effects in animal models include anti-inflammatory, dispels pain, anti-ulcer, anti-anxiety, anti-stress, nootropic effect, anti-aging. In the former USSR, medical preparations based on mamayo Shilajit are still being sold, further developed and investigated. References. Further reading: Baki, Luke R. Selected Herbals and Human Exercise Performance. The American Journal of Clinical Nutrition 72, 624 ZAR Euro 36s. PMID 10919969. Hill, Carol A. 40, Paulo. Cave Minerals of the World 2. National Speleological Society. Pages 223. ISBN 978-1-879961-07-4. Shepotkin, Igor. Kubnikov, Andrei. Kwon, Byung-se. Medical Drugs from Humus Matter, Focus on Mamai. Drug Development Research 57, 140 doi, 10.1002/DD at 10058. Frolova, L.N. Kiseliva, TL. Chemical composition of Mumijo and methods for determining its authenticity and quality. Pharmaceutical Chemistry Journal 30, 543 doi, 10.1007/BF02334644. Kiseliva, TL. Frolova, L.N. Baratova, L.A. Yuskevich, AKHPLC. Study of fatty acid components of dry Mumijo extract. Pharmaceutical Chemistry Journal 30, 421 doi, 10.1007/BF02219332. Frolova, L.N. Kiseliva, T.L. Kokhlia, V.K. Bajinskaya, A.I. Trump, T. Antitoxic properties of standard dry Mumijo extract. Pharmaceutical Chemistry Journal 32, 197 doi, 10.1007/BF02464208. Kiseliva, T.L. Frolova, L.N. Baratova, L.A. Bibikova, G.V. Xenofontov, A.L. Study of the amino acid fraction of dry Mumijo extract. Pharmaceutical Chemistry Journal 32, 103 doi, 10.1007/BF02464176. Kiseliva, T.L. Frolova, L.N. Baratova, L.A. Ivanova, O.U. Domina, L.V. Fetisova, E.K. Polchushkina, O.U. Effect of Mumijo on the morphology and directional migration of fibroblastoid and epithelial cells in vitro. Pharmaceutical Chemistry Journal 30, 337 doi, 10.1007/BF02333977. Joshi, G.C., K.C. Taiwari, N.K. Pand and G. Pand. 1994. Bryophytes, the source of the origin of Shilajit, a new hypothesis. BMEBR. 15, 1 4, 106 111. Gozal, S., B. Mukherjee and S. K. Bhattacharya 1995. Ind. Journal of INDG. Med 17, 1, 11. Gozal, S. Reddy, J.P. Lal, V.K. Shilajit I, Chemical Constituents. Journal of Pharmaceutical Sciences 65, 772 3 doi, 10.1002/JPS 2,600,650,545. PMID 932958. Phillips, Paul. On Shilajit on the Internet. Fuyuki, S.H. 1997, Nature and Origin of Shilajit, Hamdard Medicus, Vol. XL, April-June, pages 21-30, Zoller, P. Karen, A. Origin of the floristic components of Shilajit. Hamdard Medicus 41, 6-8. Shafiq, Muhammad Imshaz. Negra, Saeed Ahmad. Batal, Nib. Biochemical and trace mineral analysis of Shilajit samples from Pakistan. Nutritional Sciences 9, 190-4.